This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Bingo MP mouth paint is an antifungal treatment for oral infections. It effectively manages oral candidiasis, providing relief from discomfort. Indications and uses. This antifungal treatment is primarily indicated for managing oral thrush, a fungal infection resulting from the overgrowth of Candida in the mouth. This condition can cause significant discomfort, leading to symptoms like soreness and difficulty swallowing. The active ingredient, clotrimazole, specifically targets the infection, helping to alleviate these symptoms and restore oral health. How it works. Clotrimazole works by blocking enzymes responsible for the growth of fungal cells, leading to cell membrane damage and ultimately, the death of the harmful fungus. Directions for use. Always apply this mouth paint as directed by your physician. Ensure that any dentures are removed prior to application. The formulation is designed exclusively for oral fungal infections and should not be used for infections in other body areas. Proper application enhances effectiveness and accelerates recovery. Possible side effects. Users may experience side effects such as abnormal liver functioning, nausea, vomiting, stomach upset, itching, and an unusual taste in the mouth. Precautions and warnings. Use this antifungal treatment with caution in pregnant and breastfeeding women, as well as in individuals with liver conditions. It's essential to consult a healthcare provider before use, especially if you have allergies to clotrimazole or are taking other medications. FAQs. 1. What is Bingo MP mouth paint used for? It is used for the management of oral candidiasis or thrush. 2. How does it work? It inhibits the growth of fungal cells by blocking enzyme production. 3. How should it be applied? Always follow the physician's instructions and remove dentures before use. 4. What are the side effects? Common side effects include nausea, vomiting, and abnormal taste. 5. Is it safe during pregnancy? Use with caution, consult your doctor. Thank you for watching. If you have any questions or suggestions, please feel free to leave a comment below. Your feedback is always appreciated.